Cone Health takes a major step forward in the adoption of its electronic medical record system. I'm Doug Allred. Area physician practices join Cone Health Link. That story is in this month's Code View. All Cone Health Link practices that use GE Centricity are now on Cone Health Link. 25 practices went live on the electronic medical record system on March 20th. The change promises a new way of doing things for the non-hospital practices. Another group of offices and clinics that use paper charts go on Cone Health Link May 7th.
Yeah, I'm personally looking forward to it very much. I think it's going to be a leap forward, although there's a lot of anxiety about how it will work since nobody actually in my practice has been using electronic medical record of any sort. So for us, it's going to be a big leap.
Cone Health Link goes live at Annie Penn Hospital, Women's Hospital, and MedCenter High Point July 7th. The next time you head to a Cone Health vending machine, you'll have more choices than just empty calories. All vending machines at Cone Health began including healthy options on March 19th. Look for pretzels, baked chips, water, diet sodas, and granola bars, for example.
Currently, 3,500 of our employees across the Cone Health system are either overweight, obese, or classified as morbidly obese. So we really think this is a nice direction to move to keep our employees healthy, which also provides good examples for our community.
Broderick points out that other health systems are looking at this, and it's a good way to set an example for our community.
These are good, actually. Okay.
You have a new place to find low-cost medications. Cone Health has opened a new employee pharmacy at MedCenter High Point. The pharmacy is next to the emergency department. While similar to the pharmacy on the Moses H. Cone Memorial Hospital campus, there are differences.
The Cone Pharmacy, the one located on the Cone campus, mainly services employees. They're probably about 90% just employees, whereas here we have an opportunity to service more of the public patients and people who are seen by our doctors.
This pharmacy is open weekdays, 7:30 in the morning to 7:30 at night. Another employee pharmacy opens on the Wesley Long Hospital campus in June. Aaron Solutions has been caring for employees for a while. Now the staff is helping to care for patients. The concierge service now has an employee round the emergency department at Moses Cone Hospital during peak hours to help patients in non-clinical ways.
We've had situations where they've helped arrange transportation for people out of town. They've set up some airline reservations, just generally any type of assistance that they can provide non-clinical. And they also help us keep our patients informed, which is one of the top priorities for us.
This pilot project will be assessed in 6 months. You may have seen a couple of large trucks with Cone Health logos traveling the highways. The trucks are part of a small fleet working out of a new off-site warehouse run by Supply Chain Operations. The warehouse not only saves money, but means a wider variety of supplies can be stored and delivered more timely.
This used to come from an outside distributor where we were paying fees to do that. So our journey is to bring it back in-house so that we can be self-sufficient and help support more items for patient care.
Supply Chain Operations also improves care with a newly designed courier service. The cars bring lab specimens and other items using predetermined routes.
We really are trying to help the physicians with a more timely and quicker response, that they can help the patients quicker and have quicker decisions. The labs are able to be more efficient, the physicians are able to get their results more timely and get back to the patients and help the patients. So it's a win all the way around.
With gas prices way up, replacing large vans with hybrids on these routes will save even more money down the road. Speaking of the road, check out this CareLink ambulance. The ambulance is decked out in a red wrap designed by marketing to raise awareness in our community about heart disease, the #1 killer of women.
This is a wonderful way for us to bring our value of caring for our community to life, is seeing this in the community driving around. and raising the awareness, and also raising awareness around an event coming up that Cone Health is partnering with the Heart Association with the annual Heart and Stroke Walk on May 19th.
The ambulance turns pink this summer to promote the Women's Only in October. Finding great employees means going where they are. For talent acquisition, that means recruiting on Facebook. They see Facebook, Twitter, and LinkedIn as valuable tools reaching 4 generations of workers.
Believe it or not, the entire breadth of those 4 generations, are on social media. When you look at, our mature workforce, they're on Facebook, they're on Twitter because they're following their kids, they're talking to their grandkids. So we really find that we've been able to connect with all age groups and all age brackets.
Don't forget this is social media. Feel free to go to Cone Health Careers, like the page, and recommend that others join the Cone Health team. Welcome to a special invitation-only tea. What makes this special is that all of the guests are Great 100 recipients. 75 Great 100 recipients from over the years work for Cone Health.
The recognition of the Great 100 recipients across our system to come together to celebrate again their honor, and also to take the time to recognize that there are other people that we work with every day that also need to be nominated for Great 100.
This is an annual event to celebrate superb nurses and to sow the seeds for the next group. What better way to enjoy spring than hitting the trails on a bicycle? A group of Cone Health employees have made this easier for you by creating a couple of bicycle clubs. One is for road bikes, the other cross country.
If you like to get out and ride, we want to encourage you to get a hold of us and join your fellow employees and come out for some good camaraderie and fellowship out on the trails.
You get the snazzy riding jersey after 3 rides. If you're interested in joining, contact Scott Job via Cone Health email or at 545-1862. That's it for this edition of Code View. I'm Doug Allred, and I'll see you next time.